Great. Thanks very much, Chandra, and good afternoon, everybody. Thanks for joining this session. It's only been 2 weeks, I think, but a lot has changed and there's still a lot of moving pieces. And so you'll have to bear with me for a little bit today as there's going to be lots of new and changing information. I'll try and make sure that I leave enough time for questions, as I'm sure that you have some questions or things that I might forget to include in my updates. So please take note of them and raise them at the end. So as Chandra said, my name is Natalie Bocking. I'm the Medical Officer of Health with Halliburton Kawartha Pine Ridge District Health Unit, and we've been hosting these media information sessions weekly for the last many months, during the COVID-19 pandemic. In my update today, I'm going to cover a number of different things. So I'll include an update on the epidemiology or numbers of COVID-19 that we're seeing, updates on testing, updates on case management, outbreak management, updates on vaccination, and updates on general public health measures. And then we'll go from there. So to get started, we have had a total of 4,288 cases of COVID-19 since the start of this pandemic. We currently have 1,013 active cases of COVID-19, 74 in Halliburton, 381 in City of Kawartha Lakes, and 550 in the County of Northumberland. Now, these numbers are individuals that have been reported to public health through the provincial reporting system that have had lab positive confirmed results. Given changes in provincial criteria to access PCR testing, the numbers that we are reporting of confirmed cases are an underestimate of the actual number of cases in the community. We know that there are many individuals right now that might have symptoms consistent with COVID-19 or that may have tested positive with a rapid antigen test and are presumed to have COVID-19 infection. And these individuals are not reflected in the numbers that are on our dashboard. That being said, I think the dashboard is still, which includes the numbers of confirmed PCR confirmed cases, still is helpful to really indicate the general burden. Knowing that it's an underestimate, these are still really large numbers that we're seeing. Our 7-day rolling incidence rate is the highest really it has ever been throughout the pandemic. Today we're sitting at 509 cases per 100,000 population over the last week. We currently have 16 outbreaks that we are supporting management of. 8 of those outbreaks are in long-term care homes or retirement homes. 2 of those outbreaks are in correctional institutions, and 4 of them are in other group home settings or congregate care settings. We are not declaring general community outbreaks or other community location outbreaks, but will continue to declare outbreaks in higher risk settings, which includes different congregate care settings such as retirement homes or group homes. Our test positivity is also really the highest it's ever been in the pandemic, although is still just below or around the provincial average. So today we were, calculated today, but reflective of about a week ago, our test positivity is at 18%. There are some health unit jurisdictions that are seeing test positivity of 30% or higher. So I think the numbers we're seeing across all of these indicators are consistent with what's being seen across the province. Looking at the last 14 days in particular, and the last 14 days really have been the period of time that we saw a significant change in our epidemiology as Omicron became the dominant variant. In the last 14 days, we have had 9 people admitted to hospital, and that is definitely a significant increase from the last couple of months where we did not see many hospital admissions. Unfortunately, we do have 4 individuals that are currently admitted to intensive care units. Among those people that have had severe enough COVID-19 illness and admitted to hospital as a result of that, just to give you a sense, because as it's often a hot topic and people ask. So of those 9, one of those individuals was not vaccinated at all, and the remaining 8 had received 2 doses of vaccine. And I'll speak a little bit later on. I think we know that 2 doses of COVID-19 vaccine is, while still providing some protection against severe illness, does not provide the same level of protection as it did for the Delta variant. Hence, as we will chat later on in this session, hence the push and the emphasis on booster doses. Also, to give you a sense of the age distribution of those cases that had severe disease. So 4 of those individuals that required hospital admission are between the ages of 70 and 89. So really almost half of those hospital admissions among older age population. 2 among 50 to 69-year-olds and 2 among 30 to 49-year-olds. So while we know that individuals that are older are at higher risk of severe illness from COVID-19, we also know that individuals with other medical problems that result in their immune system not working as well are also at higher risk of severe illness from COVID-19. And we still also sometimes see younger adults without other medical problems that might develop severe COVID-19 illness. It just doesn't happen as frequently. Otherwise, if we look at the new cases that have been reported in the last 14 days, in general, the predominant age groups have been still younger adults, so 20 to 29 and 30 to 39, although we certainly are seeing more among older age cohorts as well. I think that those were the key points I wanted to highlight related to the epidemiology of where we're currently sitting with COVID-19. I wanted to provide a couple of quick updates regarding testing, and I know this is not new to anyone on the call today, as it's been widely spoken about in the media since it was announced by the province, but as just a reminder for all of our community members, there is new policy direction in accessing PCR testing. So PCR testing or formal lab testing, where you have to go to an assessment center and get that nasopharyngeal swab for a PCR test, is being restricted to certain individuals. So individuals that either work or reside in different high-risk settings, or individuals with medical conditions that put them at higher risk of COVID-19. So there are clear criteria that would make someone eligible to be able to get a PCR test right now. And the reason behind that is solely really to do with capacity of both, I think, local assessment centers throughout the province, as well as at our regional and central public health laboratories, to be able to continue to have PCR testing, but having to prioritize it among certain populations. We do also have rapid antigen tests as a tool, and the messaging around rapid antigen tests has changed as a result of limited access to PCR testing. When we had widespread and easy access to PCR testing, it made sense for us to be telling everyone, you should get the gold standard, go for the PCR test. Now that there's not capacity to do that, and our other tool is rapid antigen tests, I think we're being very specific about how rapid antigen tests can be used. So there are a number of scenarios where rapid antigen tests are being recommended right now. So one, I think familiar to everybody, is part of staff screening for people that work in high-risk healthcare settings. So for example, there have been directives to people that work at long-term care homes, among about doing rapid antigen testing on a weekly or twice weekly basis, similar with acute healthcare system. And really the intent behind that is to identify any COVID-19 cases before they're coming into contact with people that are very vulnerable to severe COVID-19 illness. Another use of rapid antigen tests now is really for diagnosis. So if somebody has symptoms, they think they might have COVID-19 and they have a rapid antigen test, then we would encourage them to use the rapid antigen test, because they're not able, if they don't meet the criteria, they're not able to access a PCR test. And this really is a change from previous direction. We know that the rapid antigen tests are not perfect. We know that sometimes people that have COVID-19 might test negative on them. And we know that sometimes there might be false positives. But given the background rate of COVID-19, if somebody has symptoms and they test positive on a rapid antigen test, then it is extremely likely that they have COVID-19. It does not need confirmation really, unless it's a very specific scenario which has been outlined by the province. We know that there are challenges in accessing rapid antigen tests right now. And well, I know there are challenges because I'm on the receiving end of a lot of questions of how people can access rapid antigen tests. There is a shortage provincially of rapid antigen tests, and what has been communicated to me and to health units is that rapid antigen tests are being prioritized for certain settings, in particular high-risk healthcare settings where we want to ensure that people that are most vulnerable, such as patients or residents at long-term care homes, are not going to be exposed to an individual that might have COVID-19. So when there's not sufficient supply, we have to prioritize. I understand that the province should be getting a good supply of rapid antigen tests soon, and I'm looking forward to hearing about what the distribution plan and strategy is for those rapid antigen tests. In the meantime, I know that for the general public, across HKPR, there has been very limited access to rapid antigen tests, and I think we'll see that continue at least for a couple of weeks. The health unit has not been involved at all in distribution of rapid antigen tests. It's been through a separate centrally administered program through the province. So unfortunately, those people that have emailed the health unit asking for tests, we don't have any that we're able to. We don't have any kind of full stop. So I think we continue to monitor this, and we'll hopefully have different messaging around that as we have more supply. That leads a little bit, or is a good segue into, I think, some of the updated guidance and messaging on what to do if you think you have COVID, or what to do if you have been exposed to COVID. So case and contact management is kind of that technical term that we've been using at the health unit. The difference between now and a couple months ago is that the health unit, or our staff, aren't the ones that are going to be doing case management and contact tracing for your average community case. At the health unit, our focus is on high-risk settings and outbreaks. I think across the province, there's no health unit that has the capacity to do the case management and contact tracing for us. We're receiving more than 100 new cases per day. So essentially what is happening right now is that when we receive a positive lab report, we screen it, we determine whether or not it's someone from a high risk setting or associated with an outbreak. If it is, we hold on to it, we do the follow-up, we connect with the facility, we assist with contact tracing. If it's not, then it gets forwarded to the provincial workforce, which is a provincial supported system that will do the follow-up. For individuals that don't have access to PCR testing, there is no requirement to report that to public health. So if somebody has a positive rapid antigen test at home, there is no requirement to report that to public health, and there's no mechanism to do that. We know that that means our surveillance numbers are not accurate to the sense that they're reporting every single case of COVID-19, but I think they are certainly realistic in terms of the higher risk settings and vulnerable individuals to more severe disease, which is really where the focus has shifted to. So if you're an average community person, you don't work at a hospital or long-term care home, and you are fully vaccinated, and you do not have another medical condition that is interfering with your immune response, and you have symptoms consistent with COVID, or you test positive on a rapid antigen test, the direction is to isolate at home for 5 days. And not just you isolating at home, but everyone in your household is also required to isolate at home with you, regardless of their vaccination status. So that's different from what it was about a month ago. If that person is not vaccinated, or if they have another medical problem that means their immune system is not as strong, then the requirement is to isolate for a full 10 days as opposed to 5 days. A couple of additional changes for those people that test positive or suspect that they have COVID-19. It's the I think collective community ask, since public health units are no longer doing this, for them to reach out to anyone that they have been in close contact with in the 48 hours prior to when their symptoms started, and let them know that, you know, now I'm sick, and you should be watching for symptoms as well. Those high-risk contacts that don't live with the individual don't need to isolate at home, but we would ask them to be self-monitoring, so really watching for any signs or symptoms. I think the guidance around this is continuing to evolve, and we're trying to ensure that all of the resources we have available on our website are up to date, and hopefully are clear for different scenarios that we know people are facing. Our call center is able to answer questions about it. I know that our call center is receiving a high number of calls, and so sometimes there might not be as timely a response as people would like. But if you're not able to get an immediate response through the call center, certainly on our website is lots of information about what individuals and families should be doing. All right, so I'm going to move on to some updates around vaccination. So a couple of updates around vaccination in addition. So speaking specifically about booster doses. So I know that our dashboard does not currently report on the proportion of the population that has received their booster dose. And this is something that we're looking at, and we just have not had the capacity yet, given the different workload and pressures to change this. But I can share with you today that among the population that is age 70 and over, 66% have received their booster dose. Among the population that's age 50 and over, just about 50%, like 49.8%, so I round up to 50%, have received their booster dose. And among the population that's age 18 and over, 37.5% have received their booster dose. A couple of comments or other updates related to booster doses specifically. There's been a little bit of confusion about when somebody is 18, when they become eligible for their booster dose. So the current guidance is that it is by their birth date. So if somebody is 17 right now and is turning 18 in April, they have to wait until April or their birth date when they turn 18 to receive their booster dose. So it's not by birth year. So I think that that has been a bit confusing for folks. The other, I think, important thing related to booster doses is that there has been a provincial shortage of the adult Pfizer vaccine. This means that we have had to restrict what we offer at health unit and primary care-led clinics for booster doses. We know that people between the ages of 12 and 29 are not recommended to receive Moderna. And so the adult Pfizer doses that we do have are reserved for that population to ensure that they're able to access Pfizer. For age 30 and over, when they come to a clinic for their booster dose, they're offered Moderna vaccine. If there's some very specific reason that they're not able to receive Moderna vaccine, if there's an allergy to it, for example, then adult Pfizer vaccine is available. But we do, I think we're trying to ensure that we still have vaccine for those individuals that can't actually receive Moderna. We do know that Moderna and Pfizer vaccines both work similar mechanisms, can be used interchangeably. And there is some data indicating that a booster dose with Moderna might actually have slightly better protection of longer duration. But I think as everyone's familiar, we continue to monitor in real time, and sometimes when we're monitoring in real time, evidence or data changes. So I think it's something we continue to monitor, but those are some of the early indications of what the data is demonstrating. We certainly are continuing to encourage people to get their booster dose if they have not yet received their booster dose. Our health unit-led clinics are posted in the provincial booking system. We have clinics available up until February the 4th, and we are currently in progress of finalizing it, and we'll be adding clinics after February 4th very soon to the provincial booking system so people can access appointments there. In total, we have just about 40,500 appointments available at health unit-led clinics across HKPR for the next month, so from now until February 4th. There are still open appointments, and that does change on a regular basis. So if somebody has an appointment but then is able to access vaccine at, say, a pharmacy, they might cancel their appointment at one of the health unit-led clinics, and then you have an additional appointment that's available. So I do encourage people to continue to recheck the provincial booking system if they're trying to get an appointment, as there do continue to be appointments that are open. We will and are continuing to monitor kind of geographical access to vaccine. We know that certainly health unit-led clinics are not the only route that people can access vaccine. There are primary care teams that are offering vaccine. There are many pharmacies that are offering vaccine. Our hospitals have supported with some vaccine clinics as well. So again, if you're not able to access an appointment at a health unit-led clinic, please don't then assume you can't access vaccine. There are multiple options. I wanted to talk just a couple minutes about vaccination for 5 to 11-year-olds. So we talked about a month ago about the rollout of COVID-19 vaccine for 5 to 11-year-olds. So there is a pediatric Pfizer vaccination for COVID-19 for this age group. Our coverage across HKPR is about average for health units across the province. So we're currently sitting at around 39% of 5 to 11-year-olds having received one dose of vaccine. I think that number is certainly much lower than where we would like it to be. We know that vaccination among this age group will significantly help to reduce broader community transmission, and help overall to both prevent illness among that age group, and to help bring the broader transmission of COVID-19 in the community under control. We do have appointments available for 5 to 11-year-olds in the system. Between now and February 4th, we have 8,900 appointments that are open for 5 to 11-year-olds at health unit-led clinics. So there is ample opportunity, and we would encourage parents or guardians to consider this. If you have questions, we have resources on our website, including some videos that speak to some of the common questions we hear from parents, as well as I think you have in addition, you have other healthcare providers, pharmacists that are also happy to answer any questions that you might have about vaccination in this age group. Let's see, I think those were the highlights that I wanted to cover related to vaccination. And I know that I've just about taken up half of the time and want to leave room for questions. So I think I'll end with just some general comments about public health measures. As of today, some additional public health measures came into effect. So we do have limits on social gatherings, so limited indoors to 5 people, outdoors limited to 10 people, additional restrictions on retail, restrictions on dining establishments, with indoor dining no longer allowed and takeout only, expanded restrictions and capacity at other venues and facilities. And I know that this was very I think challenging and disappointing for people to hear and to process. And I think that, nobody wants to be in this situation. And unfortunately, these measures we do know will help to stop and interrupt transmission of COVID-19 in the community. At this point in time, we're not looking to stop COVID transmission. At this point in time, we are looking to mitigate or decrease the impact on our acute care system. Our hospitals have already had to move to looking at canceling non-elective procedures. What's different about this wave of the pandemic compared to previous is the number of absences of healthcare workers at our hospitals that is happening at the same time as a higher number of admissions, which creates even further strain on the system. And so I think certainly in terms of short-term measures that we can do to try and keep our healthcare system safe and able to respond, those are measures that we need to take. And again, time limited to get us through. As an individual or community member, the most important thing you can be doing right now is following those basic public health measures. If you're well and you're continuing to go to work or to go out, that you're wearing a well-fitting, tightly fitting mask in any indoor spaces, or if you're not able to keep 2 meters from somebody else. In general, if you don't have to go in physically to work or you don't need to be going out, then you shouldn't be going out. You should be staying home. If you have symptoms, if you're getting symptoms, if you're unsure if there's symptoms related to COVID, there are screening tools online. Double check your symptoms. If they seem that they could be COVID, you stay home. You stay home for at least those 5 days if you're fully vaccinated and your immune system is kind of at normal functioning. And these are really the most important things that we need to be doing as individuals, as families, and as a community right now to at least slow the spread of Omicron. And I know it's hard, but we've done it before and we can do it again, and we will come out the other side. I think the hope is with Omicron, it's increasing at speeds we've never seen. And so hopefully we'll come back down the other side at an equally as fast pace. So I'll stop there and pass this back to Chandra. Thank you again, everyone, for joining, and happy to answer some questions.
Great. Thanks, Dr. Bocking. Lots of good information there. The first hand I see is from Dan. Dan, do you want to go ahead?
Thanks, Chandra, and happy New Year to you and Dr. Bocking. First off, I guess, what message do you have to people who feel like, I guess, they're maybe stuck in a cycle of restrictions and lockdowns right now in the province?
Mm-hmm. Yeah, it feels like a bit of Groundhog Day or deja vu in this cycle. I think if we think back to the fall, when we were concerned about the Delta variant, we had good vaccination coverage, and we weren't seeing the same level of severe illness. And so we didn't need the same level of restrictions. This time around, it is a bit different because the vaccines didn't work as well as we had wanted them to, and we didn't have booster doses into everybody. So I think public health restrictions are not an automatic in this COVID response. As we get other tools like vaccination, like treatments that might decrease the amount of time that people are ill, then we don't need to do these broader measures that are really aimed at protecting our healthcare system from collapsing. So as much as it's frustrating, I think the message is not to give hope that this is the only thing we can do with COVID. I think our response changes every time slightly, and we'll continue to adapt and figure out ways that we can also live with COVID-19.
Okay, yeah, and I guess my next one's kind of a two-parter. Do we know what percentage of the active cases presently are Omicron, and has there been any further research on the severity of Omicron versus other variants?
So I don't know for the numbers reported at HKPR exactly the proportion that are Omicron. I think we can assume, and this was similar to Delta variant, at some point you really just assume that it is the majority. So we would be looking at 90-95% really is the Omicron variant now. With regards to severity, there is really, I think, good data now demonstrating that Omicron does not seem to cause the same, it doesn't have the same risk of having severe illness as the other variants did. Unfortunately for our healthcare system, it's much more infectious, and so the numbers just don't then even out. We still have a very high burden on our healthcare system, despite the fact that the risk of severe illness is lower. But I think that for individuals, that is somewhat reassuring.
Okay, great, thanks.
Great, thanks, Dan. Next, I have Katrina. Katrina, do you want to go ahead?
Hello, hi, Dr. Bocking. Happy New Year.
Hi there, Happy New Year.
There is growing evidence that vaccines likely won't prevent the actual infection of Omicron, and I think that is perhaps making some people hesitant to get their booster shot with this idea that they're still going to potentially get Omicron anyway. So what is your message to people that kind of have that line of thinking?
Mm-hmm. So, I think it's similar with Delta. We knew that the vaccines weren't 100% effective at preventing transmission of Delta or from somebody getting Delta. But what they do work well for is preventing severe illness. what we'll see is if as many people that are eligible get their booster dose, we won't have as many people admitted to hospital, and we won't have as many people admitted to the ICU. And that really is the focus behind, I think, the booster dose campaign right now, and especially among older age groups that are at higher risk of more severe illness, is the role of vaccination in preventing severe illness.
Okay, thank you. And my next question is about schools. There's quite a few frustrated parents about schools going back to online for the next 2 weeks. So what is your message to parents as to why this is necessary, and what are you hoping will come of this school shutdown for the next 2 weeks?
Yeah, so I empathize with parents. This is really challenging. We know that there are harms with not having in-person learning at school. I think really moving to virtual learning only for schools is one of those really extreme measures that we only want to see in the most extreme examples. They're not our routine public health measures. I'm very hopeful that this is a very short time limited event, and we'll get kids back to in-person learning as soon as possible. I think that there's a lot of different factors that government takes into consideration when they're making and determining policies such as this, and they're not easy decisions. I know that there's a large number of parents that are really frustrated that school is online now. And I have to say, before the province made the announcement of moving to online, we were getting a large number of emails and letters from parents that really did not want there to be any in-person learning. So I think it's really balancing the needs of many different individuals and groups, but trying to use public health evidence as best as you can.
Okay, thank you very much, Dr. Bocking.
Great, thanks, Katrina. Next I have Sam. Sam, do you want to go ahead?
Hello.
Hi
I
there.
have a question about hospitals, and specifically, we heard in the press conference a couple of days ago that Doug Ford said, that the higher percentage of cases could mean higher percentage of people going to hospital, even though maybe it's a more mild variant. Could you kind of localize maybe the impact on hospitals in our region, or what you kind of predict seeing in the next couple of weeks as far as caseloads and how that might impact hospitals kind of specifically in the HKPR region?
Mm-hmm. So I guess the other thing to take in consideration in that scenario is for a region like us, for rural regions that have rural hospitals, there's kind of a staffing, sometimes even a staffing crisis to start with. I know that rural hospitals have a lot of challenges in recruiting both physicians and nurses. And so really at baseline, even before the pandemic, there were HHR challenges. And then in this wave in particular, where you have a higher proportion of your workforce that's also getting sick and not able to get into work or have to isolate at home, you now have hospitals that were short to start with are even shorter because of COVID-19, because their staff are sick. And that's the starting place you're working from. So it doesn't take many admissions because of COVID-19 to really overwhelm a small rural hospital with COVID-19. It's really challenging to estimate exactly how many people across our region will be admitted to hospital. Having 9 people admitted over the last 2 weeks doesn't seem like a lot, but again, for our smaller rural hospitals, this adds up pretty quickly. If I think about a more rural region, so Haliburton certainly right now has the highest number of cases really that have been reported in that region. And so if you take, say, 1% of those cases, you might see 1 or 2 or 3 hospital admissions because of COVID-19. But again, because the hospital is small to start with, that will already challenge the existing resources. The other thing that may start to see, and this is what happened in the third wave, is that larger urban hospitals, because they serve a much larger population, denser population, are become over capacity, and we've heard of code oranges being called already in some of these hospitals. And so they start to send patients to more rural hospitals because they're unable to accommodate them at these larger tertiary hospitals. I think at that point in time, a lot of the rural regions were not seeing the same hospital admissions. We didn't see the same numbers, and so there was some capacity to take those patients. I think there's likely concern right now that if you have hospitals at both ends that are already overburdened, you end up having fewer places that you can send people to from other hospitals. I think, you know, we don't have a crystal ball, don't know for sure, and it's still pretty early in understanding what the burden of illness or hospital admissions is going to look like over the next 1 to 2 weeks. I would expect to see over the next, let's see, we're beginning of January, 2 to 3 weeks, our hospital admissions to continue to increase. And then hopefully by end of January, it will level off. But certainly sometimes people that are admitted to hospital with COVID end up staying for a long period of time. Sorry, Sam, long-winded answer.
No, that was great. Thank you very much. On the subject of staffing, I remember hearing in mid-December that the health unit was kind of overstretched in that capacity, and that's why some changes came into place. Could you talk about how the staffing situation is now, and if your health unit is able to handle the increased jobs and just the situation that we find ourselves in right now?
Sure, thanks, Sam. I mean, I think we manage to the best of our ability, the same way as every other health facility and public health unit. We have increased our staff where we can. We continue to hire more people, but the same as hospitals, we also have staff members that now might have to isolate at home. And so we do see more absences because of that. And especially when we're running multiple immunization clinics a day, it's a pretty fast dance that's ongoing to try and make sure that we're meeting all of the needs of the clinics and of our other services. So it's definitely a challenge, and we, I think, continue to try and support staff through that the best that we can and work with what we have.
Thank you very much.
Great, thanks, Sam. I have Derek next. Derek, do you want to go ahead?
Yes, thank you. Good afternoon. Dr. Bocking, does the HKPR work with local school boards while students are at home right now doing online learning? And the second part to that is, where do you see in-person learning in the near future?
Well, there's what I see and hope, and there's maybe reality. But with regards to the first part of your question, so we have a school health team, and they meet with our school board partners weekly. And I know they've continued to meet with them weekly. So they met this week. And when school was 100% virtual last time, they continued to meet, not just to kind of talk about current public health issues, but prepare for return to in-person learning. So we do have ongoing connection with them. My hope for in-person learning is that we are back to in-person learning on January 17th, which is the current kind of window that the province has set. And that would be my hope.
Perfect. Thank you as always.
Great, thank you. I have Dan again. Dan, do you want to go ahead?
Hi, thanks. Yeah, just going off of Sam's second question about some staffing levels, I guess is it, do you feel like the province needs to provide health units with more funding to provide staffing to help them during this time in the pandemic?
So that's a tricky question, because I think immediate real-time funding is not as much of an issue. I mean, the province has been clear that COVID-19 related expenses will be covered by the province. And so our immediate staffing needs, I think financially will be covered. Sometimes there are, you know, if we look long term, it's easier to recruit people for full-time kind of permanent positions as opposed to contract positions, and those sorts of things are a bit more challenging without a long-term lens on funding, and so I think sometimes that's the piece that's missing. Honestly, often the biggest challenge really is just having enough people coming and responding, whether it's to ads and that are interested and able to come and work, and then having that flexibility based to be able to work in kind of different regions geographically.
Okay. Yeah, and being in the third year of the pandemic with the experiences that we've had the last couple of years, I guess what lessons can be applied from past winters towards this current wave?
So that's an excellent question, and I was taken aback when you said third year. I mean, I think lessons learned, every time we're at the start of a new wave, I think we feel overwhelmed or that this is never going to end. But we know that it will, and that we come out at the other end of that wave, and hopefully each wave is shorter in time and has fewer strict restrictions. And so I think one of the biggest lessons learned is that does continue to be hope and optimism that we're going to find a way that we continue to live with COVID-19 and we move beyond some of this. There are certainly technical lessons learned that we've about how we manage COVID-19. Some of that changes based on the variant, but I do think a lot of it, our biggest lessons learned are more kind of social, in that the best way that we get through these waves is through kindness and compassion and empathy, and that when we have done that, the waves passed faster, and we come out healthier on the other side.
All right, that's great. Thanks.
Good. Okay. Thanks, Dan. Catherine, I have Catherine next. Do you want to go ahead, Catherine?
Yes, just as you don't have a crystal ball, I'm sure you're not a mind reader either, but how underestimated do you believe the current numbers are, given there's far fewer tests that are being completed? And do you see Omicron peaking at any point?
So that's a really good question, Catherine. My initial gut is that we're maybe seeing half of what could be out there, but I don't have any kind of numbers or studies to back that up with right now. From what I have heard and understand in looking at other jurisdictions, I think we're hopeful that Omicron will peak really within the next 2 weeks or so, potentially 3 weeks, but that by end of January, we really this will have peaked and start to come back down.
Thank you very much.
Okay, great. Thanks, Catherine. Derek, I see your hand is up. Is that up for a second round, or is that an old hand?
That's a very old hand. I'm sorry.
No worries. No worries. Okay, I'm just double checking because I do not see any additional hands up at this time. I'm just going to check the chat just to see if I've missed anything. No, I don't see anything there. Okay, going once. Oh, wait a minute. Derek, is that a new hand then?
It is. It's not so much a question. I was just wondering, Dr. Bocking, if you had some positive words of encouragement for people.
Well, I mean, my approach is, we take each day as it comes. I think it's extra hard sometimes in winter when it's a bit gray outside, and we're not able to see the folks we would like to see. But we know that, you know, a couple of weeks from now is going to look very different. So day by day, things are going to look different. And if anything, get outside. If you're able to, go for a walk. If you're able to find other ways to connect with family, we've all become quite good at virtual everything. So go back to those things that you know help you to feel healthy and well. And I think we've demonstrated and proven we'll get through this.
Well said. Thanks.
Okay, I think that's it then, unless anybody has another hand they want to throw up quickly. Not seeing anything. Okay, so I think we can wrap up this very first media information session of 2022. And I want to thank you to everybody for participating and for your questions. Lots of good questions. And thank you also to Dr. Bocking for the information. And we will see everybody next Wednesday. Thanks a lot.
Thanks very much. Take care.